Hi, welcome to this week's video. We are on location at Dr. Marjory Nigro's office, my dermatologist who's just a rock star on this platform. You guys love her. She's going to be showing up at any minute because we are doing a special procedure here today, not on me, but on a lovely woman who works here in the office. Marjory has the new CoolSculpting Elite here, and she is just raving about it. And the woman who wants to have this procedure done is my age. She has been eating well and exercising. She has lost some weight, but she is noticing some real stubborn belly fat, which we women in midlife tend to battle. It likes to stick in certain areas. And so this is considered an accompaniment to a certain lifestyle that we choose to embark upon when we want to live a healthier life, but sometimes we don't get to see the results that we often desire. So Marjory's going to step in here in just a second to talk about the new CoolSculpting Elite. You're going to meet Paige and hear why she is so interested in trying this for the first time, and I'm excited to bring this to you. So thank you, first of all, for doing this on camera. You are a brave woman.
Thank you.
Not everybody would volunteer.
Thank you, thank you.
So I appreciate that because I think you're going to help a lot of women who struggle with this particular area. And we are the same age, we're 55, and you're choosing to do your midsection area.
Yes.
One of the things that women who go through menopause talk about all the time is menopausal belly fat. It is stubborn, right?
It's real.
It's real. It is real. And you sit there and you eat properly and you work out and you do all the things that are necessary. And I'm a huge proponent of that. But sometimes that area just sticks. Is that what you're finding at this age?
Exactly. And I exercise, I try to eat right. I've committed with a girlfriend to do 1 5K every quarter. So, you know, I have a commitment to keep myself out there running, but I do just have a spot in my abdomen where I just can't seem to change it.
Yeah.
And that's new since I've, reached the age that I have.
Welcome to the club,
yes.
Right? One that we wish we weren't a part of.
Yes.
There are so many wonderful upsides to it, but there are things that can be very, very frustrating. And
Right.
I think it can make women sort of stop in their tracks because you can get so sidetracked with something that's not serving you, and you can stop doing things that are serving you.
Right.
Right?
I would agree.
So how would you say that this procedure, and you've seen it in patients, do you feel that this is something that needs to be an add-on to what you're currently doing?
Yes, and I'm excited to try it, and I've talked to people who've done it, and they seem to have great results and no downtime. I can go back to work tomorrow, and I really look forward to seeing the new results.
Yeah. Is there anything that you have to do differently when you do CoolSculpting?
No, I mean, after the treatment, they said I could go back to work. I can continue exercising. So it's not like a surgical procedure where I would have to do rest or downtime or, take time off of work. So that's what I'm excited about.
And also you can't, I think people look at these treatments sometimes and they think, well, I can just do a CoolSculpting, but I can, continue to eat a certain way or drink a certain way. And it's everything works together. There's no one magic bullet, but you still have to be disciplined in your lifestyle.
Right, exactly. And they explain that to me too. I do weigh myself before the treatment, and I weigh myself on my post follow-up, and you have to maintain that weight because it's not going to work if you don't maintain your weight.
Yeah.
So
now the question is, what do we do with our loose skin?
Yes, exactly. So
is there a treatment in-house for that?
Yes, I know. So we'll see what is the next, but
yeah,
I'm excited to try this.
Well, I thank you for doing this, and I'll be so curious just to talk to you throughout the procedure, just to see how you're feeling and what it's like, because I think experience is everything, and people are so curious, but they want to know what you're experiencing. So thank you up front for just being honest and vulnerable with us and just sharing what your goals and your hopes are.
Okay, I'll talk you through what I'm feeling, so I'm excited.
And we're going to follow up with you too in 3 to 4 months, because we do want to see before and afters and just how you're feeling and what your overall takeaway is from the treatment.
Okay, sounds good.
Promise? So it's a
promise.
date.
It's a date.
Okay.
See ya.
Done. So I'm with Marjory. We're in the room where Paige is going to get her CoolSculpting treatment. This is the new Elite that you've been talking about. Yeah. And not only is it this, but I see a whole bunch of stuff on the wall back here.
It's so cool. It's a brand new machine. We're so excited we got it, and I think it works great.
Okay, so explain the overall. I know you're going to walk us through as she gets the treatment, but give us the difference between Elite and the other CoolSculpting, just the regular one.
CoolSculpting.
Yes.
So the regular CoolSculpting is started in the market around the beginning of 2000s, and we acquired the machine in 2009. We have used it since with great results, but then all of a sudden, right, we have this new machine, and we wanted to know what is the difference with that. So the technology evolved really a lot over these past years, right? The machine now knows exactly what kind of device we need to really get the area of your skin that needs to be treated. The previous machine was more straight, didn't have many angles, and you wasn't able to get as much skin on. And as I'm going to explain in the future during the session, the more skin and fat you can get under that machine, the more destruction you're going to have. So the machine will only affect the cells that can be cooled during the process. So this is why we need as much as possible. So this gets an extra 30% more skin and fat in the machine. It has less discomfort than before because the cooling is more gradual versus very intense and fast. And we can treat more than one area. So when people want to do, let's say, 2 areas, the sides of the thighs, inner thighs, the back fat, they would have to do one treatment, wait, come back, another treatment. With the machine now, we are able to treat both areas at the same time. So in one treatment, you can treat both sides.
Is the treatment session as long as it was with the original CoolSculpting, or is it shorter?
It's even less.
Wow.
In the past, we needed 1 hour per area. So you can imagine, sure, it's not a lot because, you know, a liposuction session is 3, 4, 5 hours. So this was less, but still, if you wanted to treat, let's say, your lower abdomen, then your upper abdomen, and then the thighs, you're
3 hours
talking about 3, 4 hours in. Now we can do the thighs at one time, we can do the lower abdomen, and then all you have to do is the upper abdomen. So in the time for each treatment now is half, it's 30 minutes.
Oh, wow.
So it changed a lot.
We're all in our mid-50s. We're all the same age. Menopausal belly fat is a real thing. It is stubborn. And like Paige was saying, I'm doing all the right things, but I am still not getting rid of this. Do you recommend this for a woman of midlife who's doing everything right but struggling?
Absolutely. This is really not a treatment for someone that wants to lose weight, okay? This is not for that because the amount that you lose is not enough to make a difference in the scale. This is a treatment for someone who decided to change the lifestyle, who wants to be healthy, who exercises, who eats well, and has those little pockets that really don't go away. And for you to get rid of that pocket, you would have to lose so much extra weight that then we look older. You know, let's just tell the truth. Women our age who decide to be really, really, really skinny,
you get too
your
gaunt.
face starts to fall, you start to feel. So we need to kind of monitor that, being healthy but not too skinny, and so we can address little pockets of fat just like that.
Got it.
I had my treatment when my daughter was 2 years old. I had kids late in life, so I was around 45. I lost the weight, but there was never a way I could lose the muffin top. So you're always upset, your jeans are always sticking out, and you're not feeling comfortable with that. Skinny pants, there was a time skinny pants started, and I hated them because the loose pants are so much better, right? You don't have to worry about that. But and then the machine came out, and I decided to do one treatment for that, and that's what this machine is for.
Got it.
Pockets of fat you always wanted to get rid of, the little things sticking here, here on the side, your inner thighs, and that it works incredibly well.
Okay, great. Before Paige comes in, she's being photographed because you've got to have before and after benchmarks.
Exactly right. We have to, the first time you'll be evaluated either by me or one of my PAs or any of the doctors in the practice, and then we're going to discuss what are your goals, areas that have to be treated, a medical history is taken, because this is not kind of a fun deal. This is
It's serious.
a medical procedure.
Sure.
You know, we are freezing cells underneath your skin that are close to organs. So this has to be something evaluated before and after. Pictures have to be taken so we can assess what is the best area for that to be, for the machine to be done. And the weight has to be documented the day of the procedure. Because, you know, of course, we all know that if we gain a bunch of weight after the treatment, the results are not going to be as good.
Yes.
Although the cells that are destroyed in the procedure can never form back again. So you don't get back those cells, but you increase the size of the cells you already have. So sure, you can gain weight after. It has nothing to do with the treatment. So we always tell patients, if you keep the same weight and you come back in 3 months, that's when you're going to see an amazing result.
Right.
Results have to wait a little bit to be seen. At the beginning, with my experience, I was kind of bigger for a good 2 weeks. You're kind of swollen,
I would think.
because you're creating an inflammatory process and telling your body fat cells bad, destroy them. So your body's going after those cells that were frozen by the procedure, just like we learn in chemistry, that when you freeze something, it creates crystals, and the crystals rip the cells. So those cells become kind of half dead.
Yeah.
So your immune system goes there and destroys them. So you are having an inflammation going on where your body is destroying your own cells. So you do get some swelling, you do get a little bit of discomfort, nothing. I worked and went to the gym right away.
Yeah.
But you have that. So don't expect, I'm going to be in my jeans the next day, a size lower, but you will see this gradually. After a 2-week period that you're a little bit bigger, you start to have the loss, and in 3 months is when you see the final result you had.
Perfect. All right. Paige.
So Paige is going to do this for the very first time. She has never done CoolSculpting before. Paige has been really great over the past year. Paige went in a super healthy diet. She exercises forever, always did.
She said she runs, doing marathons and all of that.
Yes, she exercised so much more than I do.
To me, that's a marathon, Paige. I'm sorry. I'm happy if I get around Memorial Park.
It's amazing. And she lost weight, and she's in great shape. But unfortunately, there is this pouch under the abdomen that is refusing to go away. Paige is a mother of 3. We're mothers too. We all know what happens to you after you give birth.
Oh, well, then go through menopause,
Yeah,
add that.
so fun. And so then what happens is not only the pouch, but the skin
gets
kind of
loose too.
and not in great shape. So that's the other advantage of
Does this help with the loose skin too? Stop it.
It does? Girls, the best, because the deal is inflammation, right, creates fibrosis. Fibrosis tightens everything. So once you have all that inflammation going on in the skin in that area, you're going to form some fibrosis and the skin will be pulled in. So this was a big concern I had too when I had mine. I said, so what's going to happen now?
Am I going to have saggy skin?
Yeah, and then have saggy skin. And no, that skin becomes very hard and it touches and pulls back.
Because that's the other thing that women hate.
And unfortunately, we have to say, liposuction doesn't do that. No. So when you have liposuction, the fat is removed with a cannula. It's sucked up. There's no inflammatory process remaining. So many times, if there's a lot of fat that was removed, you have to then do a tummy tuck to get rid of that
loose
skin.
Okay.
So we've never had a patient after CoolSculpting that needed to go through surgery or anything like that.
That's an amazing upside. So what's Dee Dee doing right now?
So this is Dee Dee, my River Oaks esthetician. We have 3 estheticians. You're going to be able to meet all of them. So Dee Dee is the one starting the procedure, and she'll explain to you what she's doing.
All right, I'm cleaning the skin.
Okay.
The cleansing pad. I'm about to attach the gel pad. So this protects the skin.
Right.
So a gel pad is a thick layer of, let's say, a special gauze that is going to be on your skin when the machine is positioned in. So that creates a cushion between you and the machine, so the skin doesn't get bruised and doesn't get hurt by the part of the machine that touches it.
Right.
It's kind of cool, Paige. Sorry.
You okay?
Yeah, it's fine.
Okay.
Cold's good. So that we apply that a pad in the area that will be treated. So
Okay.
this was already discussed with Didi and Paige, the area she wanted. Didi marked that, and so that's where she puts the pad on.
And I decided just to do one applicator because my main concern was like right here.
Okay.
I could have done two, but this was like my primary concern.
Right.
Didi said one
You just need one.
Yes.
And from what Marjorie's saying, the way these new applicators have been designed, they're bigger and they pull in more skin and more of the fat.
So this is the
Yeah.
applicator, okay? So this is the area where there will be vacuum created once it touches Paige's skin, and the vacuum is gonna suck the skin and the fat that have to be treated. Everything that is inside here is going to be reduced to the temperature of a refrigerator. And I'll explain to you guys the fun part about that. But it's exactly the same temperature as a refrigerator.
Okay.
And that is the temperature where fat crystallizes, but liquid doesn't. And this is a real important thing to know, because if you kill the cells of liquid,
Right.
you are crystallizing blood, you're crystallizing cells, you're crystallizing other things that can't be removed. We only want fat. And this is the exact temperature that can remove only fat and preserve everything in the tissue.
Okay.
Okay, ready?
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 All right.
Paige is like,
She's like, let's get this over with.
All right, move a little suction.
it's gonna be a suction, Paige.
All right. How was that?
Yeah, it feels like a little suction.
Okay.
And this is a big difference with the Elite versus the other machine, because the Elite starts the suction very slowly and it pulls the tissue. The machine before, when you put it on, it did a big suctioning right away. So for me, for a good 2 minutes, I lost my breath, because you're like, okay, what is going on? So these patients are much more comfortable, and as you're cooling the skin, you're kind of numbing it. So by the time that she gets the big suction, you're numb. So you don't even know pretty much what's going on. So that's
It started.
more
It's
comfortable.
starting to get a little cool. Yes.
Yeah, but not overwhelming.
No, we're just like a little cold.
Okay.
Comfortable.
Like, yeah.
Comfortable. So for the abdomen, Didi recommends, for the amount of fat tissue, Didi recommends 45 minutes.
Okay.
And then at that point, we are going to show you when the applicator is removed.
Okay, what it looks like.
Yeah, what it looks like. So our other estheticians will pick up from there.
Yeah. Perfect.
You doing okay?
We're gonna
it's
see.
just- it's cold. But
Yeah.
Nothing.
Nothing overwhelming.
No. Like
Nothing
you have
bad.
ice, like if you had a headache and you put like a, a
Ice
cold
pack.
ice pack on your head.
Right.
So then I think it's kind of fun to explain the history of CoolSculpting, because it's a real cool thing. One of my best friends from dermatology and worked here for a while is now dermatologist at Harvard. And she met and works with the creator, one of the amazing brains who developed the CoolSculpting, Dr. Rock Sanderson. And the way that he says he came up with that idea is so incredible. So he is serving the food for the kids, and he gets the milk out, and the milk is liquid, and he gets the orange juice out, and it's liquid, and the oil out, and it's liquid, and then he gets the butter, and the butter is not liquid, it's solid. So that kind of got in his mind, like, why? Why in the same temperature,
Yes.
some things are liquid, some things are solid, right? So then we got the theory of the popsicle. So popsicle, solid, frozen, and kids, there is a disease that kids get disease. It's an occurrence that kids get when they suck on a popsicle a lot, and they keep the popsicle in the mouth and suck on it, that they get some destruction of the fat on their cheeks.
Really?
So Dr. Anderson was just thinking, okay, what is going on with that? And so he kind of realized that there is a certain temperature where liquids are still safe and fat is damaged. And that's why the whole machine operates at the exact temperature of a refrigerator. And the important thing to do is to keep it that same temperature. That's why it's so important to have such a specific machine, and it's all computerized. Sensors are coming in and out of Paige's skin to say if her skin gets any lower temperature, it automatically brings it back. So she has to stay on that refrigerator at 3 degrees Celsius during the entire procedure. So then we can guarantee that nothing is going to be hurt, no skin is going to be damaged at all, and no organs or nerves or anything of that sort.
So you're basically chilling.
I'm chilling, and
How are you feeling?
It feels. It's starting to not feel as cold, actually.
Yeah, because you're getting numb.
Right?
Yeah.
So now she doesn't feel cold anymore because now the skin is numb.
Yes.
So you can't feel it.
Yeah.
So this is showing the stages of the CoolSculpting, right? So a patient before the CoolSculpting with the abdomen kind of like out this way, CoolSculpting is done. We wait for it a little bit, and at the end of the treatment, how much that big fat pad that you can see was the marked here by the blue line, how much it reduced. And you can see the skin is not sagging over it. The skin is being pulled back at the same time. That's the tightening that comes with it. The skin is being pulled back at the same time.
And is this after just one treatment?
This is after one treatment, yes.
How do you know if somebody needs more than one?
Very personal and very different from person to person. What all the research, because now there were how many million treatments done?
11 million.
11 million treatments are done all over the world. And now they have much more data that they can tell you. So what they say is the highest satisfaction, over 90% satisfaction, is when you do 2 treatments, right? Because then you address those cells, address a little bit more of the cells around, and then you really have a nice amount of fat loss and tightening. But I have to tell you that for me, I did 1. And when my daughter was 2, she's 13 right now, and I never had to do another one. I got the results I wanted. I'm fine with that, but 2 treatments is what they recommend for the highest satisfaction. And it's individual. Each patient will do it, reevaluate in 3 months. At that point, to decide, do a little bit more, keep it as it is. So that's how we recommend. So what you see here is the fat layer. So the surface skin, fat layer, organ, muscle under it, right? This is the area that being sucked into the machine, right? The blue cells here were the cells that were frozen. So you can see that there was freezing throughout the skin. What happens to that? The skin is fooled with the inflammatory process, destroyed the blue cells. The white cells reorganized. So that's the reason why after CoolSculpting, you don't have those edges that you can get with liposuction.
Boy, the body is an amazing thing.
Isn't it amazing?
Yeah.
It's so cool.
It is
So the cells that are still there, they rotate with each other, they slide through, and they give you this smooth appearance that you wouldn't have even with liposuction, because many times you're removing the cell, and you could have, obviously, with a professional that is a real good professional, it's not going to happen. But with the CoolSculpting, we're sure that it's never going to happen. Always smooth and always kind of looking even and tight.
Even with something as safe as this is, there are always inherent risks. So let's talk about that.
Yes, we cannot deny that. And as I say to Dominique and to all our patients, it is a medical procedure. I know we want to make all these things be every day, you can get it anywhere, it's just so fun, let's go have a party and get this done. We are dealing with medical devices that are destroying cells inside of your body. So really, this has to be monitored by a physician. You have to have your personnel really well trained in trainings that are not 10-minute trainings, that are not on the computer. All my Paige, my administrator, with all my estheticians, they went to a 3-day course, a whole day course, where they learn everything. Everything makes a difference. The way you put the machine, the way you put the gel, the way you start the timer. All of this is super important, right? And at the beginning, when I got the machine and they started saying, oh, you need to do all this training for people and all that, we did. And at that point, Didi was my main esthetician. And we said, okay, let's just see what happens. And we got another esthetician that had never done anything. And I said, just look at what she's doing. So I did one side of my thighs and another side. One side Didi did it, one side the other esthetician. And I was crooked for like 4 months until I got another treatment. Because if you don't hook the machine perfectly, if you don't know how to address the level of the cooling, you're just not going to have a result. You're going to have the same treatment. You're going to pay the same amount of money, lay down for the same amount of time, and the treatment is not at the same level. So really, really think when you're trying to get that procedure done, always go to a physician first. Make sure you don't have issues with the area you're going to treat. Do you have a hernia? Do you have any stitching that was done in some area around that? You really want to have a medical evaluation before you are going to submit yourself to that. So then when we do everything right, still you can have some side effects that there's no way to predict. So the one side effect that have happened, thank God never in my practice, but it happens in 0.033% of patients. So really, really very few of them is what we call pH. That is when the area treated all of a sudden gets bigger again. And it gets bigger with fat that for some reason the patient created new fat cells. To this point, we don't know how that can happen. We don't know why. We don't know if this patient is more likely than that patient. Is it how tall you are, how big you are? We don't know. It happens very rarely. And the good news with that is that the treatment is simple. It's liposuction to that area to remove that fat. It isn't, when you look at it this way, oh my gosh, this is kind of dangerous, 0.033%. But then you see, what's the option to remove a little extra fat on your abdomen, right? The option would be liposuction. So if this fails you, liposuction is still the only way to go. And liposuction, if we did this to all these millions of people that had ZLT, the incidence of complication would be much, much higher than 0.033. You're going to talk about anesthesia complications. You're going to talk about incision complications, scarring, perforation of organs, and other things like that. That still the people who need it go through it, and all these amazing plastic surgeons who are doing it, they have very, very few complications. So I still trust liposuction. I'm just saying that when you're going to judge that side effect, you have to really put it in the big scale of what are you talking about, comparing
overall.
It to.
Well, and there's price. So liposuction, it can be thousands of dollars. What is CoolSculpting?
CoolSculpting, depending on the area you are doing, goes from $750 to $1,500. So
per treatment area.
Per big area, it all depends. If it's a smaller application, it utilizes a smaller computer cartridge, so it's cheaper, because the big expense here is the computer cartridge that every patient has one.
Is that this?
That's it. That's a computer charge that is only for Paige. As soon as this machine turns off, this is completely damaged and it can't be used again. So that's the part that is so expensive. And it is such a delicate part of equipment, because that is sensing Paige's temperature constantly. To say that, no, now it's too cold, now it's too hot, warm it up, cool it down, warm it up. So we really need that part, and that's what makes the treatments expensive. It's one per patient. It's a hard drive.
Yeah.
You know what? That's
it's a hard drive.
And a big area uses an entire big card. Small areas is used. So that's why when you want to really know the price, you have to come. Consultations for CoolSculpting are free. So you come for a complimentary consultation with a physician, with a PA, with an esthetician, and then after we are measuring you, marking, then we're going to tell you the exact amount that you would spend per treatment.
Okay.
So that
so $750 to $1,500.
Yeah.
By the way, how are you?
I'm fine. Very comfortable. I mean,
so
I can barely
Paige is
feel that
on
it's on.
30 minutes, so pretty much 15 minutes of her treatment are done, and she kind of feel good. She's working.
I really feel. I feel nothing really. Yes, I could work, and
she's all good. And we can show you guys some pictures of previous
some before and afters.
Yes, before and afters of
our
staff.
Yes,
because as you know, we can show the staff, but we can show real patients. But the staff is always our guinea pig. Sometimes it's great, sometimes not so much. But for the CoolSculpting, we have very good results to show.
Okay.
Okay.
Perfect.
So we'll leave Paige here and be right
I'm
back.
good. Okay.
So, Dominique, I wanted to kind of show you guys, because Paige is having this treatment right now,
Right.
and we're gonna do a follow-up with her in 3 months so we can really bring you guys pictures of Paige. But here we're showing one of our nurses that had this treatment, and as you can see, she had results very fast. She had the treatment in October of 22, and she had already results December 22.
Yep.
She didn't lose any weight. She was the same shape she was before, but you can see how much smaller the amount of fat cells was, how much she looks tighter after the procedure.
Was this just one, what's
just
the name?
one treatment on the lower abdomen.
And one piece, or what do you call those?
One applicator.
One applicator.
It was that applicator,
Yeah.
right?
The same?
The same one that Paige is using was
Because
applied.
you know what I'm noticing? I mean, not only did she lose the lower abdomen fat, but even just a little bit here on the outside,
sides,
the
too.
sides are, everything's pulled in.
See, this is the real amazing thing about the CoolSculpting, because, like I told you, with the cells sliding in, when you have an area where the fat cells are dead, cells from the side start to come in. And as we all know, we can't form new fat cells over the age of 2. By age 2, all our fat cells are formed.
I didn't know that.
All we can do, if you didn't know that, all we can do is to make the cells we have
Bigger or smaller.
So when you gain weight, your cells are getting bigger. You're not making more cells.
Interesting.
So over here, when you start sliding cells over each other, you get a loss of
Cells,
fat tissue
yes.
all over the place.
Interesting.
So this is the deal. We only make fat cells up into age 2. And that's why we worry so much about toddler obesity, because once a toddler is obese under the age of 2, they're forming more and more and more cells. So that child, as an adult, will have many more cells. They can absorb much more oil and grow much more. So they have a much bigger chance of being obese in an older age. Let's say my nurse was bad and starts
eating chocolate cake every day?
Yes.
Yeah, I'm going to do this and then just go out to the McDonald's drive-thru.
Cake, ice cream, right, Edie?
Yes.
Yeah, we could be very unhealthy.
Yeah.
So then what's going to happen? She will gain volume of the fat cells that stayed behind, but she will never gain the cells again. She will enlarge the fat cells that are left behind, and so she can become, but not, those cells are done.
Once they're
for
gone,
good.
they're gone.
That's it. So this is another thing that is a real...
How do they leave the body?
How they leave the body? Oh, that's a very interesting question. The first thing that we thought, 10 years ago when I got the machine, it's going to go to your bloodstream, all this fat.
Yeah.
So it's terrible.
Yeah,
right?
that's dangerous, isn't it?
Cholesterol, triglycerides, people with diabetes. I have diabetes. What's going to happen to us? So then research was done on that. Where's that cell? We're dosing fat on patients day by day after the treatment and all that, and nothing changed. And it's like, that's so weird. So we found out that the fat is absorbed by the capillaries that are in the tissue that absorbs, right, T?
Yes.
And so it's absorbed by the vascular that is not the blood, it's the lymphatic
the
capillaries.
lymphatic system.
So we have 2. We have blood vessels that carry blood, and we have vessels that carry liquid, that carry liquid from all over our body. That's called the lymphatic tissue. So the fat was found in the lymphatic tissue. The fat's already damaged, so it can increase your levels of anything, and part of that goes to your urine, part of that goes to the stool. So you could experience a little bit of loose stools on the 2-3 weeks following the procedure.
Right. So you do excrete it.
You do,
but you don't sweat it out.
You don't sweat it out, and it doesn't go to your blood. You can eat your chocolate. It's not going to raise
but
your
not recommended.
cholesterol. No,
Yeah,
not
because that's kind
recommended.
of counterintuitive to 750 to 1500.
Yeah.
I would think too, if you're going to make this kind of commitment and spend this kind of money, it would be an extra kickstart to live healthy and make good choices, right?
That's exactly what we see on patients over the past 10, 12 years that Didi has been doing this treatment. We see that this stimulates patients to stay on target.
Yeah.
So it's like, why? I spent this money, I look this good, and now my pants are nice, fitting well, why am I gonna eat this extra ice cream?
Yeah.
Or that's a good idea for me to go take my walk, do my little run, go to the gym.
Yeah.
So the majority of patients keep that result for years.
Great.
They come back to see us because, you know, I do all their skin checks forever.
Yep.
So we see these patients on a regular basis, and I can say the majority of them are keeping the result, and then
Yeah.
they decide, oh, now I want to do the legs, now I want to do this and that.
It becomes addictive, I can
Yeah.
imagine, when you see these
Yeah,
kinds of
it's-
results.
so-
But when you look at the wall of paddles, it's like,
Look
geez,
at
the
that.
possibilities
There's
are
all kinds-
endless.
So, Didi, show some paddles.
So this is the S150. This treats the outer thighs. Here. This one treats the chin
Okay.
underneath here.
Where does
Over
it
here?
attach? Because people wonder about that. For a
Yeah.
facial area, I didn't realize that you can do the face.
Yes.
So you go
Yeah.
under there?
Under here.
You go under there.
For
and
double chin?
Yeah, when you have the double chin, when you have a little bit of extra fat in this area, we do that.
Also here.
Oh,
for the
side
armpit
fat.
area.
The
This
side
armpit area.
fat
Yes. Right.
that
Right here.
some people have.
Okay.
Yes. And then these pretty much for the under the arm here.
Oh, tricep.
Yes,
Yep.
tricep area.
Right?
It depends. Everybody's shape different, so sometimes we have to use these if we can't use the curved ones. So it just
Okay.
depends. You can use them anywhere.
No, and sometimes in a very small abdomen.
Yes.
This will be
Yes.
better than.
So these two typically treat the sides, and like there's two because we can dual sculpt. You can
Yep.
do two at the same time.
Yeah, so you would say back fat,
Back
side
fat,
here.
love handles,
Okay.
bra fat,
Right.
everything.
And what about, because women just
thighs.
hate.
Oh, I hate that.
This.
I had
Okay.
this. I had this.
That's called the banana roll. So
Where's that?
that's what they write.
Oh, this can do
This.
banana roll.
Banana
too.
roll.
It's okay.
Yes.
Oh yes, that'll be good.
Oh, that. Oh,
because
here.
when I had mine done, we didn't have the special applicators, so it was a straight application that took forever to
Oh,
adjust.
and then you said you had an
done.
uneven result
I had
from
an
the old-
even result, so this is really much more interesting.
This is the smaller flat applicator.
Right.
So if the arms are smaller, it attaches.
Okay.
Yes, this
What
is better for the
about
smaller
inner
arms.
Inner
thigh or above?
This
can
is
do
also
that, right?
inner thigh, and you can
Okay.
also treat
inside
the
of
knee.
the fat
Inside
here.
the knee area.
Wow.
Very interesting, Didi. I hadn't seen that one.
So with
So
the
basically, any part
Any
of the
Any part.
female body where we store fat can be treated.
Any
Yes.
part can be treated,
Yeah.
and we just need to examine the patient, make sure
Right.
you don't have a hernia, you don't have an issue
Yes,
underneath
underneath.
the skin.
so they're all the
and,
same except different sizes for different
and
areas.
so the difference between this and the old cool sculpting is how many more paddles
There's
do you have?
more applicators.
Way
There's
We
more.
only
way
had
more.
two.
We only
Maybe
had
two?
Three.
Yeah.
Three.
But first, when I bought the machine,
Oh, yeah, when we
two.
first got it, it was
so
two.
in 2010,
Right.
There was
two
only
applicators,
two.
big, small.
small.
That was the
Yeah.
option. They were all straight, like square shaped,
Mm-hmm.
and that's what we had. Then 6 years ago, they came with the third one. That
Mm-hmm. Yes.
was the small one
chin.
for the chin. But that's all we had until the Elite came out.
And then now there's
because
a
now they
there
have
is, yes.
Got a
all
wall
of them.
full.
yes.
Yeah.
How
So-
you doing, Paige?
We forgot about Paige. Paige is still here. She's still good. We have 15 minutes to
Paige
go.
is asleep.
So that's it. We're almost
chilling.
there. So it's all good. And whenever the time is up, we are going to have our esthetician Elizabeth coming in.
Wine.
Yes,
Cheese.
wine and cheese will be after. Yes, after we talk to you guys. So then we can have a celebration. But that will be when the treatment is done. Elizabeth is gonna come and show you guys how the machine is unhooked, how the skin looks right after that. And then finally, our esthetician Maria will come in and show you a very important part of the procedure, that is the massage of the tissue. And you will see when the applicator is removed, Elizabeth is going to show you the part of the tissue that you see. And it's the part that the patient's like, oh my gosh, because it brings all the fat to the surface and it kind of looks like a stick of butter. And that's when you think, I will never
Do this again.
do this
Yeah.
in my life because this was really bad. And so that means all those cells are pretty much dead and crystallized. It's hard. It is as hard butter.
Wow.
And so then when, so Elizabeth will show you that, then Maria is going to do the massage. Massage is very important to send these cells back because what do we want with that? We want the dead cells to call the inflammation process to destroy everything, and sometimes you destroy even more cells just because those cells can bring so much inflammation to that area that other cells are going to be killed too. Important to know that there's no restrictions after you do this. Different from obviously liposuction, you need bed rest, you can go back to exercise for a while, you have to wear all these garments and all of that. There's absolutely no requirement after this.
What about age?
Age, any age.
Anybody.
We've treated all age groups if you have an indication for that. If you have an area to be treated, we can treat anybody. We've treated elderly people, we've treated anyone who wants to lose that. Paige could, straight from here, go to the gym. She's not, because we're gonna have like a glass of wine and she's tired. But you could go to the gym right away.
Yeah, you feel no pain afterwards.
No pain. Tomorrow she might.
Okay.
When the inflammation starts,
okay.
you might feel a little weird tenderness, a little cramping.
Yeah.
I had what we call hyperesthesia. That means the nerves, the skin nerves, the very superficial skin nerves that were submitted to the cold, the next day they get a little bit stimulated. So you feel weird. There's more sensation and all that. Numbness.
Yeah, a little itchiness.
So for the next 2 to 3 days, you feel weird stuff.
Yeah.
But nothing that stopped me. The next day I went to my Pilates class.
Nothing stopped
did
you.
nothing. Yeah. Well, as you know, we have an extra energy here going, but that was it.
Brazilian energy
So that just some little extra, but life continued. I had a 2-year-old, went back to school, picked up my baby, went about my life. You can eat, drink, whatever you want to do. If the sensation is bothersome, for me, I didn't bother that much. There's a medication for that. So then you get in touch with your physician. There is a medication specifically made for nerve sensations. And so we use that during whatever, a week or two. It goes away completely. My sensation completely back to normal. Next day, you can get some swelling. So there is a chance that for the next 2 to 3 days, Paige is going to say, what the heck, I had this treatment and I'm bigger. And so that happens because just imagine all the inflammation that is going there to destroy these cells, right?
Yes.
So you could be swollen, so you could have to wear your elastic pants, scrubs, scrubs, but that goes away completely. That's why the evaluation of the final result is at 3 months.
Perfect.
I don't wanna
Time's
stand in
up.
front of you.
Are you excited?
So excited.
Okay.
So this is Elizabeth, my other esthetician, and she will tell you guys the second very important part of this procedure, that is how to unhook the machine now that the time is 0. Paige is still cool, and we're going to do that. So go ahead, Elizabeth. What are you going to do?
So we're gonna turn the vacuum off.
Okay.
All right. Then I'm gonna ask you to just hold this right here for me.
And you still feel nothing, I assume.
nothing.
Remove
Okay.
the boppy. So the trick is to put your finger
Underneath. Oh, you're releasing the
to
suction.
release the suction, just like that.
Right.
So you're not damaging or hurting her.
Right.
And then we're going to put this over here.
Okay.
So as
Yeah.
you can see, the gel pad has protected the skin from the cool. You can also tell that there's that stick of butter that we talked about earlier. So it's nice and frozen. So I'm just going to remove.
And that's a warm towel
It's
that
a
you're
warm
putting
towel.
on.
How does that feel, Paige? Do you feel anything? Is it discomfort?
It doesn't feel warm because I really
Doesn't,
can't
because you
feel
can't
it.
feel anything.
It's numb.
I feel nothing.
Yeah, so great.
So if we were using the old CoolSculpting Legacy machine, we would have only 64% of the tissue being sucked into the vacuum, into the applicator, versus the 94% that was taken into the new one. Yeah.
As Elizabeth showed you guys, the entire area here is red. That's the entire area that was treated, and that's the entire area where the fat cells were damaged. So this is Maria, my esthetician, and Maria is from Brazil like me, but Maria is gonna come in and do the massages on the patient after the treatment.
I just go straight.
Okay. Oh, so you don't have to use any type of an oil, a gel, or anything. You're just using your
Just
hands
go
to manipulate.
straight hands, and I do like a kind of a deep massage.
Okay.
So this is going to stimulate more inflammation, right? Activate the cells for better results. And now I
How
go.
does it feel, Maria? Is it hard?
It is hard. I can feel very cold, of course, and it's a little bit hard. I can really feel the cells here, the fat, and now I just do this little.
And how long do you do the massage for?
About 2 minutes. The machine has a timer,
Oh, okay.
so I just go for 2 minutes.
Paige, do you feel it?
Yeah, and I would say it's not like a massage, like
No.
a comfortable massage.
No,
Sorry.
no, should not be. I'm sorry,
It's
Paige.
deep tissue.
Yeah.
Yeah, yeah. It's more like a stimulation, right?
Yeah, so
For
it's
the-
kind of pokey and
Yeah.
a little uncomfortable, but I mean,
Yeah.
not painful, but
Yeah.
it's not.
You want to spread those dead fat cells around the tissue to trigger inflammation that might kill more cells around it. So that's why she pushes it down and spreads it to the side.
Yeah, and like I'm a little bit aggressive, I can say, with her, but that's what you are.
You
You
want
have
that.
to do. You want to. You have to do this for the better results for Paige. Sorry, Paige.
No, I mean,
And
it's
a
all
lot of
worth it
patients
in the end.
ask me, should I massage more at home? And my answer is, more massages will never hurt you. And so I would say maybe the night of the treatment before bed, the next day you put a little bit of oil in the skin and you rub and push down. That is not going to hurt anything.
Okay, so let's say that our friend Paige here is just thrilled with her results. When can she come back for round 2 if you feel or she feels that she needs a second go around?
Second go. So, second go around.
Oh,
The second go around
Just
that
handing
can be
around
done basically anytime.
thank you.
We always wait a minimum of 2 weeks because there's going to be a lot of inflammation going on here. You don't want to add more inflammation. She could still have a little bit of sensitivity and tenderness. So minimum 2 weeks. But there's no maximum, okay? Paige can come here and say in a year or 2, okay, I'm ready for another one. So what is destroyed is destroyed. It won't regenerate. What she would do in the future is destroy more. And so anytime can be done after 2 weeks and forever. It's not a problem.
So we're going to come back. We're going to revisit Paige in what, 4 months you say?
3 months will be good.
3 months will be good
Right?
enough?
Yeah.
And then we'll be able to see, they took your before picture.
Yes, they
We
did.
will then see your after, and we'll talk to you about the changes that you felt and noticed, kind of, you know, the after treatments. What can she expect in the next couple of days?
So yeah, the next couple of days she will have a
Swelling,
little
I
bit
know.
of swelling,
Yep.
you know, a little bit of swelling in the area, a little bit of sensitivity. But as I was talking to my estheticians here, the incidence of real pain that was very common with the old machine, I would say at least 50% of our patients had severe discomfort, nerve pain, and for some of them we needed to medicate them. I had a lot of discomfort myself 12 years ago. My estheticians are saying, since we got the new Elite, nothing. They haven't prescribed one medication to any of the patients. So I would suspect a little bit of numbness and a little bit of discomfort, but in 3 months, Paige will be able to tell you guys.
That's great. Well, we look forward to seeing you in 3 months.
Yes.
Thank you
Yes.
for doing this
Yes,
and for
yes.
being brave and showing this to my audience. And for my gosh, I feel like if I had to take a CoolSculpting test, I would pass it.
Yes.
I know more about this machine than
And
think
I learned a ton with my estheticians too, okay? Because nothing like someone who does that all the time.
It's
to know the
amazing.
details that even I don't know. So,
But look,
it's
that is
so
the
good.
one thing that I appreciate about you is that you come with knowledge. And this is now, I'm serious, and this is the second video we've done together. Marjory did a Sculptra treatment on me for collagen in the face, which was amazing. We did our first video together of Retinol 101. So we're going to provide links to these videos because you are a wealth of knowledge. I appreciate you so very much. You've helped so many women
Oh,
in
and
many
love
ways.
That. I love
I
that.
know.
Your followers are incredible. They are women like us who
Yep.
want to look good, who don't want to be artificial or
Yep.
fake.
Yep.
And they're real people with real jobs and real lives. So
That's right.
I love talking to them. All of the followers that came to my practice, I met online, even from outside the country.
Yeah.
It's been a wonderful experience. Thanks to you,
Oh.
you put together all these incredible people. It's amazing.
Thank you. I'm blessed because of you. So thank you. Thank you.
Thank you.
Oh my God.
Friend.
Thank
We'll
you,
do this
Paige.
again.
See you in 3 to 4. Okay.
Okay. Bye guys.